The dissection of the femoral triangle. The femoral triangle is located on the anterior aspect of the upper thigh. Its base is situated superiorly and the apex is situated inferiorly. The base is formed by the inguinal ligament and the medial border is formed by the medial border of the adductor longus. The lateral border is formed by the medial border of the sartorius. At the apex, the sartorius crosses over the adductor longus. The floor is formed from medial to lateral by the adductor longus, pectineus, and iliopsoas muscles. The contents of the femoral triangle are the femoral vein, femoral artery, and femoral nerve. The femoral artery and vein are enclosed within the femoral sheath. Outside the femoral sheath, at the base, is the femoral nerve. It lies lateral to the femoral artery, and at the superior lateral angle is the lateral cutaneous nerve of the thigh. The femoral artery is a continuation of the external iliac artery, which is a branch of the common iliac artery. Beyond the inguinal ligament, it is known as the femoral artery. It enters at the midpoint of the base and descends to the apex. It gives off several superficial branches, including the superficial epigastric, superficial circumflex iliac, superficial external pudendal, and deep external pudendal arteries. The most prominent and largest branch is the profunda femoris artery. It arises from the posterolateral aspect about 4 centimeters below the inguinal ligament. It descends and curves medially to the femoral artery. It gives rise to the lateral circumflex femoral artery, which may also arise directly from the femoral artery. It also gives rise to the medial circumflex femoral artery and several perforating branches. These perforators either pass above the adductor brevis or pierce the adductor brevis and adductor magnus to enter the posterior compartment. The femoral vein at the base lies medial to the femoral artery. It receives the great saphenous vein about 3 centimeters below and lateral to the pubic tubercle. This occurs at the saphenous opening, which is covered by the cribriform fascia. Medial to the femoral vein lies the femoral canal, which has an opening toward the abdomen. The anterior boundary is formed by the medial part of the inguinal ligament. The posterior boundary is formed by the pectineal ligament. The medial boundary is formed by the lacunar ligament. The lateral boundary is formed by the femoral vein. The femoral canal usually contains a deep inguinal lymph node known as the lymph node of Cloquet. It receives lymphatic drainage from the glans penis or the clitoris. The profunda femoris vein accompanies the profunda femoris artery. It drains into the femoral vein, distal to the origin of the profunda femoris artery. At the apex of the femoral triangle, the arrangement is femoral artery, femoral vein, profunda femoris vein, and profunda femoris artery. The femoral nerve is the largest branch of the lumbar plexus. Initially, it passes lateral to the psoas major muscle. It then appears in the groove between psoas major and iliacus and passes beneath the inguinal ligament. It lies lateral to the femoral artery and outside the femoral sheath. Just below the base of the triangle, it divides into several branches. These include cutaneous branches, the medial cutaneous nerve of the thigh and the intermediate cutaneous nerve of the thigh. It also gives rise to the saphenous nerve, which supplies the medial side of the foot. The saphenous nerve enters the adductor canal. Muscular branches supply the sartorius, rectus femoris, and pectineus. The roof of the femoral triangle is formed by the fascia lata and the overlying skin. There are superficial inguinal lymph nodes arranged along the inguinal ligament. They are also arranged along the terminal part of the great saphenous vein. This is to show you further details of the contents of the femoral triangle. You can see a lymph node here, which is medial to the femoral vein. This is the deep inguinal node of Cloquet. We have reflected the sartorius superiorly and the rectus femoris. Now you can see the branches of the femoral nerve. This is the saphenous nerve. It accompanies the femoral vessels into the adductor canal. These are the muscular branches to the quadriceps femoris and sartorius. You can see here the profunda femoris artery. It arises from the posterolateral aspect of the femoral artery. One of its branches is the lateral circumflex femoral artery. It has 3 branches. The descending branch descends toward the knee joint, supplying the anterior thigh muscles. The ascending branch appears over the vastus lateralis and passes between the sartorius and tensor fascia lata. Therefore, it can be damaged during anterior dislocation of the hip joint through this space. The other branch is the transverse branch of the lateral circumflex femoral artery. This joins with the transverse branch of the medial circumflex femoral artery